Well, thank you very much for that introduction, Adam, and also I'd like to thank the organisers very much for inviting me here today. I feel very privileged to follow on to such august speakers, and particularly pleasing to follow on from Barbara yet again. She always steals my thunder. I'd just like to add to her talk. I think, if I'm right, that is it right that the three major QSR restaurant chains have now all switched to healthier oils? Give it up for the quick service restaurants as well. Thank you very much. Anyway, I'll go on. Of course, this isn't the beginning of a journey. It's actually another step or more steps in a long journey that's been taken by the food industry to bring you healthy, affordable and safe food here in Australia. And of course, the AFGC, as the peak body representing the food and grocery manufacturers in Australia, has played a small part in helping the industry walk down this path. Just to give you some indication of that, because I know that some of you look very young and may not have even, I'm sure you were born in 2005. But anyway, it's not a story that everybody knows, but it is worth repeating. In 2005, of course, the Food and Grocery Council sponsored, to the tune of $1 million, the Australian Children's Nutritional and Physical Activity Survey. The AFGC provided that funding as a prompt to government to get good data about the levels of obesity in children and their level of physical activity. In 2006, we launched the Daily Intake Guide. This is a front-of-pack labelling scheme, certainly not the first in Australia. Perhaps the tick was the first, but certainly another attempt by the food industry to give more information to consumers to help them make healthy eating choices. In 2009, we launched the Responsible Children's Marketing Initiative. That was matched by the Quick Service Restaurant Marketing Initiative, where it gives guidance to food companies on responsible promotion of food products to children. In 2009, with the Commonwealth Government, we brought together the Food and Health Dialogue, and we've already heard about the Food and Health Dialogue from Cathy Dennis this morning. In 2012, we launched the Go Scan mobile phone app, which we are still supporting very strongly. And in 2012, we launched the Australian Food and Grocery Council's Healthier Australia commitment, which is what I'm going to talk to you mostly about today. But of course, in this time, there have been ongoing company commitments. And of course, we've also heard from Barbara about trans fats. Of course, food industry in Australia, particularly Goodman Fielder and Unilever, led the transformation of our fat supply to one that was relatively free compared with international standards of trans fats in the 1990s, even without regulation. I'll just go back one. Of course, there are other examples, and in fact, my good friend and colleague Megan Cobcroft published in Food Australia in 2008 some examples of salt formulation programs across a whole range of food companies, including McDonald's. So industry has always been part of the preventive health program, and I think it's very important for everybody to understand that. We're here to help in terms of being part of the solution, and hopefully you don't think we're the main cause of the problem. But what is the Healthier Australia commitment? Well, it's an industry-led, multi-year strategy to assist Australians improve their health and well-being. It's a food industry initiative, obviously, in partnership with other organisations. It's about trying to build healthier families and educating Australians about the importance, particularly, of energy balance. We have a holistic approach. That means we're trying to combine everything together, which could be a bit ambitious, but we have three action areas: in the community, in the marketplace, and of course in the workplace. These are our current members, and you can read the logos, but major food and grocery manufacturers here in Australia, but also Exercise is Medicine Australia and ESSA, which is the Exercise and Sports Science Australia, two of our main partnering organisations at the moment. This is the essential framework. The aim, as I said, healthier Australians, to promote solutions to help families because they're healthy, to be healthier through the energy balance maxim, I suppose, healthier choices, and also physical exercise, which is often the poor cousin to the food and nutrition and health advice that we give to consumers. The platform, the community, the marketplace and the workplace. In the community, education and activity. In the marketplace, it's about product choice and consumer information. So product choices goes directly to the reformulation issue, and consumer information is about, exactly about that, about how we promote our food products not only in frank advertising, but also on labelling, and so of course the front of pack labelling debate is going to be tied up in those initiatives. The workplace, it's about employee wellness and sharing resources, and I'll be talking a little bit more about that in a moment. Our approach is collaborative. I think one of the things that the Australian Children's and Physical Activity and Nutrition Survey demonstrated was that the food industry is very able, and in fact almost a mandatory partner to these programs, if you like, if you really want to leverage the power that the industry has in making changes. But of course we work with non-government organisations, and we also worked with academia. The measures, of course, there's a fundamental truism, I think, that if you can't measure it, you don't know whether you're making progress. So we're trying to look at initiatives where we can measure what we're doing, and that will then allow us to do the evaluation. So part of it is establishing baselines, and of course in order to do that, when you're measuring things, it's ideal to have independent organisations to evaluate the process, and we are in partnership with KPMG, which is a major consultancy and accounting firm here in Australia. So these are our actions. It's a bit of a crowded slide, so I'll just pull out a couple of initiatives. So in the marketplace, it's improving the nutritional quality of food and promoting healthier food options, and I've already talked to that, and it's about an ongoing commitment to reformulation. In terms of our workplace, we've been partnering with Exercise Sports Science Australia. We've launched a range of resources that are now used by our member companies to help assess the nutritional status and the health status and the physical activity status of their employees, with the aim to plotting out strategies to help them improve against those measures. The aim of that is to reach not only the employee but also the family. In terms of our community work, this is again about communication, so connecting with Australian families about energy balance via a Together Counts website, which I'll show you in a moment, and helping to develop tools which enable them to understand perhaps the importance of nutrition, how to balance their nutritional requirements. So here we have some of the more specific information. We've got targets around reducing sodium, saturated fat and energy from our foods. Product choices, it's about differential investment in marketing to help shift product choices by consumers, and promoting healthier diet options to consumers. In terms of communication, it's actively implementing consistent food and beverage labelling, and of course we've been heavily in that debate, and the Responsible Children's Marketing Initiative I mentioned before. Now, when it comes to targets, this is one of the things that has been more difficult for us to implement, and I'd just like to give you a little bit of a line of sight of that. We've set some targets there, and they're clear at the bottom: sodium reductions of 25%, saturated fat by 25%, and energy by 12%. But these are actually weighted average reduction targets. Now, a lot of discussion in the past in reformulation has just talked about percentage reductions of risk-associated nutrients in the food supply, and the measurements of that have been simple surveys which have been, well, perhaps just a little bit simplistic. We don't really understand how much people are eating, at least from the food supply, unless you have not only the composition of food products, but you know the market share, in other words, the volume that is going or being consumed by consumers. So it's actually, content times volume. It's very difficult to measure that. In reality, it is proved quite a challenge for us to set up targets of how we might do that within the Healthy Australia commitment. But of course, this is a public health intervention of sorts coming from the industry, so there's been a focus on the main brands of food companies, because obviously they're the ones that carry the most nutrients, both positive and risk associated. But as I said, it's been a bit of a struggle, first of all, setting the targets, and we're still looking at how we look at the baseline data, and it is subject to variations which are sometimes beyond the company's control. For example, volume share can go up and down without a company actually having direct control of that. It can be due to promotions by the retailers, for example. But anyway, we're looking at trying to get a really good handle on that to give us some tracking of where these nutrients are going, and we'll either be successful or we won't. The targets will be independently monitored and reported by KPMG to ensure that we're meeting our obligations that we've set under this. In terms of the employee wellness, well, of course, I mentioned this is about engaging the community or the employees in the workplace and trying to make companies realise, which I think they probably do, that the healthiness of their workers is an integral part of their productivity. You're all familiar with the concepts, well not the concepts, but the problems of both absenteeism from work, but also presentism in work, which are people not titrating their own health properly, and the impact that they can have on how they perform when they turn up at work. We're trying to establish if there are best practice programs out there, getting measures of how effective they are in terms of influencing their workers, and then sharing those best learnings across the Healthy Australia commitment members, and then ultimately into the wider community of companies within the Food and Grocery Council. So we are a major employer. We employ about 200,000 people directly. The employees on average work, God, is that only 7 to 9 hours? I work more than that. Well, some days I do. Workplace wellness obviously can have a great reach, and the idea is if the employee is relatively healthy, it can perhaps flow through down to their family and into the community. So we're aware that, of course, our employees are potential victims of non-communicable diseases, and this is a way of our accessing Australians. We're hoping that it will decrease inactivity and increase knowledge in our workforce. The main challenge, of course, in workplace wellness is participation. They don't have a great record in terms of sustained effects, but we're hoping that by partnering with the right organisations such as Exercise Sports Science Australia, we will get some traction in this area as well. These are the sorts of tools that have been developed. It's a physical guide to a guide to physical activity in the workplace, and a Be Active Work survey, which is basically an online tool that workers can use to which assesses their own physical activity and wellness levels, and you can then give them direct feedback. In the community, again, it's about partnership and promoting the energy in and energy out maxim. I won't dwell on this too long, being aware that we're of the time constraints, but we've been doing it really through a website, but also trying to engage with the community more directly through the mainstream media. The website is the Together Counts website, and if you Google that, it will take you to it, of course. Our ambassador is Susie O'Neill, the Australian Olympian of some years ago, and she's been helping us trying to promote this concept of physical activity to balance healthy eating through mainstream media and other ways. Of course, this wouldn't be an industry presentation without a commercial, so we're holding an event on the 1st of April 2014. It's part of the Healthy Australia commitment. It's basically a seminar symposium like we're having today, where the latest science on the importance of physical activity and maintaining well-being is being promoted. We're doing it in partnership with ESSA, Exercise Sports Science Australia, the Australian Diabetes Council, and Beyond Blue. What many of you probably know very well is, of course, physical activity is not only important in terms of trying to address or trying to help people maintain a healthy weight. It's also very important in other health outcomes. So it's linked to mental health, it's linked to diabetes, obviously, and it's also linked to things like osteoporosis and so on and so forth. So this concept of physical activity to assist in the health and well-being of consumers is very important, and we are attempting to promote it through the Healthy Australia commitment. In terms of gaps and opportunity, well, gaps, good data on actual consumption of key nutrients. I think one of the things we've learnt over the last little while is perhaps there are gaps here about how much we're eating, of course, of the key nutrients. Of course, the health survey data will show some of that, but I'm not sure it'll necessarily give us all the information we need. I think there's a shortage of real apparent consumption data, and it's possible that the industry is in a position that it may be able to help with this in terms of volumes of key nutrients that are being consumed. The controversy about whether sugar consumption has been going up and down in Australia, for example, is a key key example of the real need for some very important data to be provided there. Consistent application of the concepts of evidence-based health, public health. Everybody pays lip service to this. Some of us maybe need to think a little bit more carefully about establishing some fundamental paradigms of what that evidence-based public health actually is. I think there's a gap in the adequate nutrition literacy of the general population and most of the media. We're amazed at how many times we get myths fed back to us about general nutritional wisdom, if you like. The opportunity, a national food composition database with brand level data. Certainly applaud the work that's been done by the George Institute. We've also been working in that area to try and build up a national food composition database. It's populated in real time as food changes by the food companies, and it has the potential to form the basis of good public policy if it's accessed by the public health community and also by government. Establish mechanisms for multi-sectoral engagement and partnership. If it's one thing that we've learned from the front of pack labelling debate, not to mention the Food and Health Dialogue, and before that the nutrition survey, the Children's Nutrition Survey, is that we can get good outcomes with everybody who has a role in public health being around the same table. But one of the key things we still don't understand is how to change knowledge into action, particularly for consumers, and this seems to come back again and again. No matter the fact that we have probably, I call it the nutrition paradox. We have an extremely wide range of nutritious foods, which is more affordable than it's ever been to Australian consumers, coupled with a broader potential knowledge base of nutrition across the board. We still can't get consumers to make the sort of choices that they should be making. And I'll just mention that, just in case you didn't hear it the first time, our Move for Health conference does come with free lunch and, of course, free rego. So thank you very much.